Welcome to AM News.
Good morning, thank you.
Firstly, tell me about your organization.
Well, the South African Breastmilk Reserve is a public benefit organization that focuses on supplying end-to-end human milk banking services to public hospitals in an effort to reduce infant mortality at the perinatal stage and at the newborn stage.
But exactly what does that mean? Break it down for me.
It means that we basically inspire and encourage and support mothers in donating breast milk, and we use it in the neonatal ICU as an emergency procedure to assist to those infants who are not able to access mother's own milk in the first 2 weeks of life. What this does is reduces infant mortality rates in our very premature population from somewhere around 40 to 60% to 10 to 20%. So we see dramatic mortality reductions, sepsis reduction, pneumonia, and all the conditions that are associated with the lack of breastfeeding.
That's fantastic. That's almost like donating blood, but in this case it's donating milk, right?
Exactly.
But it must be mothers that donate this milk. Have you got, how many members have you got?
Last year we had 1,093 donors and 1,689 recipients of human milk banking services with a really high success rate. So those are our unsung heroes, you know, the mummies that donate this precious medicine to help other babies in the hospital environment.
Is it safe though to give one milk of one mother to another baby?
Well, absolutely. You must ask yourself how safe is to give the milk of a cow to a human being, for instance, which is a question we never ask ourselves. However, we do ask ourselves, is the milk for humans, by humans, good for humans? And this is indicative that we need to normalize breastfeeding and our relationship to breastfeeding as a society. So yes, it is like donating blood. It is very specific to our metabolism.
Now, have you started hosting the free pregnancy awareness?
We do it over the entire month. This isn't only hosted necessarily by us and Netcare. This is actually an initiative of the Department of Health as well. What is important about this is we are encouraging women to become aware of reproductive health, early detection of pregnancy, and once we detect pregnancy, the Department of Health urges all mothers to attend antenatal care within the first trimester, i.e. at the outset. And what this will do is it mitigates the risk of conditions that may be exacerbated by pregnancy, such as diabetes, hypertension, and so on. Also, it allows for HIV testing and counseling so that we can have an understanding of what is the sexually transmitted infection situation, early recognition of danger in pregnancy and postpartum, which is a key to reducing maternal mortality and infant mortality, and birth preparedness in terms of complications and so on, and also the role of the father and the community. So this is a month when we focus on reproductive health, family planning, and obviously infant survival, which is what is driving all of this.
Why is this important? Because it seems like you're an activist for breastfeeding.
Yes, well, we're actually an activist for infant survival. So we are part of that movement that is trying to reduce infant mortality by 2/3 by 2015 from 1990. This is Millennium Development Goal number 4, which says that we're losing still a very large number of infants in sub-Saharan Africa and in East Asia. And we need to reduce these mortality rates, and we have reduced them by as much as 17,000 deaths a day by 2013. In South Africa, we were losing, and I'm not saying we are losing because I would like to believe that this statistic would change at the end of the year. We were losing some 70,000 under 5-year-old children. Of this, 20,000 are within our population. These are preventable deaths. And we need to become participants in this as a society. And why the activism? Because we know that by bringing the baby onto the breast, we can reduce a lot of the mortality risk that is associated with malnutrition, pneumonia, diarrhea, and all the things that are the plight of the developing world. So it is an important aspect of parenting and family bonding as well.
Talking about the MDGs, the Millennium Development Goals, how far are we in terms of that?
I am an endless optimist, and I know that we have an amazing team of people and stakeholders that have been working really hard, particularly since 2010 and 2011, when we launched the campaign for the accelerated reduction of maternal and infant mortality in Africa, as well as the Tswana Declaration on breastfeeding. I will not preempt it. We will know at the end of 2015 when our statisticians and our experts and academics will have collected this information. children.
Now, you're talking about this awareness weeks, and I know that you're doing it in conjunction with Netcare.
Yes.
Is it only for private hospitals, or are you doing for the public as well?
We're doing it, we're not doing it, Netcare is one of our largest funders, and you know, 2 out of 3 bottles that are collected in all their hospitals are donated to the public sector infants that will not necessarily have as easy an access to mother's own milk, or where the situation may be different from an access to resources point of view. So Netcare has been a benefactor, and in fact, from the Stork's Nest point of view, they are quite fundamental in education. But this is happening everywhere, in all the private healthcare providers, as well as in the public sector hospitals. 44 banks under our umbrella, of which only 9 are in private hospitals. The remainder is under the tutelage of 4 of the provincial departments of health that have seen in this an investment in infant survival. So we have a lot of work.
Is there monitoring of the stock that comes in from all the milk that you receive?
Absolutely. We have really high quality systems in place. As you can imagine, we need to meet certain standards of microbiology, of care, and of quality that are associated with cold chain.
And of course preservation.
And preservation, because this is all frozen products.
Yeah.
So we basically receive the breast milk from donors that are healthy and that live in hygienic environments. We store it frozen. We pasteurize it, which takes care of all those organisms we do not want in the breast milk, and then we distribute it equitably under 1.8 kilos that is younger than 14 days and for a maximum period of 14 days, prioritizing the public sector infant.
Does it ever go off?
No, well, 6 months. So we can store it for up to 6 months. But there is a very rapid turnaround in this, because we do have a large population of premature infants. And in fact, we also want to expand our guideline up to the infant that is born full term, that may not necessarily always be HIV exposed, but that is failing to thrive.
Mothers that are watching this program right now and hearing this for the first time, and they want to contribute to you and be a member, how do they become part and parcel of your organization?
Well, it's very simple. You can find us on 011-482-1920, but you can also find us online on our website, www.sabr.org.za, where you will find that we have a map, and you can find the human milk bank closest to you. But you can also phone us, especially if you're in the Gauteng, Pretoria area, and we sign up from our head office.
So saying that it's a milk bank, you don't get any money for it, do you?
No, well, we're doing it under the Human Tissue Act, which specifies that we need to behave in a certain way when we use human tissue.
Now I'm talking about the donors.
No, absolutely not. It is not allowed.
Yes.
Absolutely. Also, as I say, the Human Tissue Act says we're not allowed to pay donors, which also protects the quality of the exercise. It is a charitable exercise from the bottom of the mother's hearts. Most of our donors are, in fact, in the public sector hospitals that are participating in this initiative, and it is the mothers in the very same neonatal ICUs that have excess breast milk that are donating it to the breast milk bank on site. We're sort of recycling it and feeding it back into the system. What is notable is that we actually also have the 2nd largest human milk banking network in the world in South Africa, second to Brazil.
Now tell me something. What advice would you give to expectant mothers out there today that's deciding not to give their children breast milk?
Well, I'm hoping that this is not a decision people will soon make as a decision. You know, from my point of view, I take a hard stance and I say parenting is a choice. Lactation should be viewed as a species-specific duty and obligation. And I invite these mothers to take in consideration that there are over 60 pathologies in life, or 60 diseases and illnesses that are directly associated with the lack of breastfeeding. This is also a question of food security. So if you're deciding to not breastfeed, ask yourself, can I afford 1,000 Rand a month of formula? But more so, can I afford to mitigate the outcome of disease, of morbidity? Because a lot of children that are not breastfed in the first 6 months of life will be victims of pneumonia, diarrhea, malnutrition, and we see this in the public sector hospitals by and large. So we are inviting mothers to take parenting back into their hands. This is also a question of a woman heritage, female heritage. You know, it's part of our role in society. And we're hoping that in time we will renormalize this role, and that we will marry it with our economic role, our role in the marriage, and so on.
My grandmother used to say, breast milk is the best milk.
Exactly, absolutely.
There we go to leave it. Stasha, thank you so much for coming in and joining us here on AM News.
Thank you.